Well, the COVID-19 cases continue to increase almost on a daily basis in the country. There are currently over 100,000 cases. Those are positive cases, with over 50% of those in the Western Cape. It's unclear how much of an impact this will have to medical aid schemes. And let's discuss this now and other related matters. And we're joined by the Board of Healthcare Funders researcher, that's Charlton Murove. Mr. Murove, thank you very much for your time. You represent about 52 medical aid schemes across the Southern Africa region. How has COVID-19 impacted your industry?
Well, thank you for having me, and good morning to you and your viewers. Yes, so the pandemic has had impacts on many levels. I think what the industry is obviously worried about is its ability to pay for claims should we hit the peak. And then there are other problems associated with that, ensuring that beneficiaries have access to care during that time, that our health system will not be overwhelmed. And then when the lockdown started, there were worries around how beneficiaries are accessing care. We saw very low levels of utilization. We're worried about people on chronic medication not being able to get their medication, and those who had some medically necessary surgeries who could not go to hospital for all this. So on the health front, that was the worry. And then in the long term, we're worried about what would happen in terms of the job losses that you were talking about. When people are not earning an income, they cannot be members of medical schemes. So that has impacts on long-term sustainability.
Yeah.
Some of our members are in the SADC region. They had concerns around accessing PPE and other medical necessities which they normally access across the border.
Yeah.
So these are just some of the challenges that we experience as an industry. We're worried about some beneficiaries who could not even afford to pay for their claim, for their medical aid, just because of the lockdown, and they were not earning an income. So the industry tried to come up with ways of keeping them on the scheme with having some access to healthcare.
Charlton, that talks to the issue that you have just touched on, which is that of sustainability, the industry worried about its survival chances. But linked to that is the issue around fraud and wastage. How much of an issue is this within the industry?
Currently, we have not really seen problems associated with that locally. When we look at what has happened in international markets, there were some reports of new fraud syndicates which were targeting the medical schemes and the beneficiaries. So they designed all sorts of schemes asking people to go for tests which were not real tests. So we have had an eye on it. Unfortunately, in South Africa, we haven't had any reports of things like that happening.
Why is it such a big worry, the issue of sustainability? One would think that the industry is very well capitalized, if you like.
So in the short term, sustainability is not a worry. There are sufficient reserves which should see us through this pandemic. The sustainability question comes in when you look at things over the long term. If the economy fails to do well, the number of people who are employed obviously will reduce. I think we saw yesterday that the rate of unemployment was at its highest level just before the pandemic. I think the number of employed people is actually going to reduce. And then we've also seen some industries reducing people's income. So these two factors obviously reduce affordability for medical schemes. So the number of people who drop out of the medical schemes is going to increase. And then that obviously then speaks to long-term sustainability. Should the economy recover very fast soon after the pandemic, then there might be less things to worry about on that front.
Yeah, very briefly for me, the medical schemes themselves have not been without blame. Some people, particularly the medical practitioners, black medical practitioners, accused the industry of racism. And I just want to get from you what the findings of the Section 59 investigations were, because they've not been released.
Yes, so the Section 59 final report has not yet been concluded. The last we heard from the investigating panel is that they are working through the final stages. Our understanding is that they've had representations from both the practitioners who accused the schemes, and the schemes also made representations. So we are also eagerly awaiting to hear the findings of that panel.
All right. Thank you very much for your time. Charlton Murove is the head of research at the Board of Healthcare Funders.